Good day, ladies and gentlemen. I am Dr. Arvind Poswal from Dr. A's Clinic, Delhi, India. Now, today, the topic which we will be discussing is of benefit both to patients as well as to young doctors who are entering in this field. So, today we'll be talking, first of all, we'll be talking about the concept of mega session. What exactly does a mega session means? Should you go for a mega session? And who does a mega session successfully? Now, now is 4,000 grafts per day a mega session is in FUE? Is it safe to do that much? I do not think so. At present capabilities, that is more of a marketing gimmick. However, I do not say that it is just not impossible, because for patient, mega session may not necessarily be the best choice. Often, mega session, if anything, it benefits the clinic. Maybe they are able to finish the procedure in lesser number of days. However, for young doctors who are entering into this field, this mega session creates a sort of psychological barrier. Every time even a new doctor starts thinking that I should offer mega session. Remember, mega session or maybe 2,000 grafts a day or 3,000 grafts a day or 1,500 grafts a day is not something which one learns from day one. Similarly, it is not something that you earn just by the number of years that you have been in this profession. It is something you learn by the number of thousands and thousands and thousands of grafts once you have placed them, taken them out. Then you understand that yes, I can take out 1,000 grafts. Yes, I can take out 2,000 grafts. Yes, I can handle this sort of surgery. Right? So at the start, I would advise all doctors, young doctors, as well as others entering into this field, not to set unrealistic targets of 4,000 grafts a day or so, such things. That is not helpful for the patient as well. Now, how should the patient choose? The patient, for him to choose, him or her, they have to decide, they have to see case studies, see how many patients the doctor has treated and has shown the complete results. They should number in hundreds. If the doctor claims to have done thousands of graft procedures, right? So, increasing the number of grafts is not something that happens on day one for the procedure or the clinic or the doctor who is doing this procedure. That is a capability which is built up over years. There is no shame in saying, okay, initially nowadays I can go only for 500 grafts or 600 grafts. What you have to make sure is not that how many grafts you can take out. What you have to make sure is how many grafts you can successfully transplant, and they should grow 100%. We do not want grafts dying out just because someone just was too fast, wanted to achieve a particular number, right? Remember, this is something which I normally say. Hair transplant is not for the weak or faint-hearted. And when I say this, I mean the doctors. If you think that hair transplant is an easy thing, then let me stop you. It takes a lot of grit, determination, and effort. And sweat, of course. Before you can actually say and put your hand on your heart and believe, yes, I can do 2,000, 2,500 grafts. And they will grow. Right? It's been more than around 22, 25 years since we have been doing this thing. And I have no shame in saying that 20 years ago, in a single day, we used to take out something like 750 or maybe 1000 grafts. Even today, I admit we go for around 2000 grafts a day. But we know that when we take out those 2000 grafts, they are going to be healthy, they are going to grow, and they are going to give. Now, what happens supposing a patient wants to go for 10,000 grafts? Sometimes the patient says, okay, this is one-time thing which I want to do. So in that case, normally what I say is intermittent procedure. I'll come to the intermittent procedure later on. But before that, let me say, how much drug load, how much medicine load, or let's say how much anesthetic load can a patient's or a person's body bear? Now this, as most doctors know, is the fluid used in local anesthesia. Now how much of this is safe? Is this much safe in a day? Is this much safe? Or is this much safe? Now, after calculations, this much is the only thing. Now, this is 30 ml of lignocaine with adrenaline or epinephrine. For the patient's body in a single day, this is the amount that the body can safely metabolize and tolerate. So I'll tell you the importance of this. Now imagine a person wants to go for a lots of grafts in a single day. I would dissuade them. Now if they say no matter the time, give me more, then the problem comes there. How much of the local anesthesia will you give? How much will his body keep on bearing? So that is why this is the strict 1 day limit, I say, for the human body. If a person wants to go for more number of grafts, he should be advised to come and get it done on multiple days. We have surgeries where we require maybe 11,000 grafts, even 12,000 grafts in a single visit. So that is where we come to the intermittent session. An intermittent session is, for example, we are doing hair transplant procedure by the fuse technique on the patient, taking grafts from the head, from the chest, from the armpits and wherever, and putting them from the beard and putting them on the head. Now what we do and advise is, if let's say it's just 4,000 grafts or 6,000 grafts, we can do day 1, day 2 and day 3. But if it is something like 10,000 grafts, I advise that you break up the surgery into day 1 and day 2 and then give a break. That is called intermittent session. That breaks helps the body. You operate on 2 days, give a break for 1 day or maybe 2 days, then operate again. The body metabolizes the harmful chemicals, etc., and can tolerate more. It's something funny. It's something like they say, when the coronavirus pandemic occurred, nature healed itself very fast because the human beings were closed in locked doors. Similarly, if the nature is left by itself, it can tolerate a level of medication and metabolize it and let no harmful effects come to it. But if a person says, let's go for, let's say, 9,000 or 8,000 grafts in a single day, now that is something very harmful, something where you should stand up, open your eyes and think. Because for taking out that many grafts, it requires a lot of time. Now time is of essence because after some time, the effect of the local anesthetic wears off. So we have to inject more local anesthetic. But if you say, how much more? We cannot just keep on injecting more and more. So there is a limit to the amount of anesthetic which you can inject all over the head or wherever you want. You do not carry on the surgery for 15 hours. It is of no benefit to the patient. Skip, stop, do the remainder the next day. Go for a 8-hour, maybe 9-hour surgery, but stop after that. The patient's body needs rest. So at best, what I say, so-called mega session clinics claiming that they can do so many grafts, I say good, maybe good for you. But the more important thing is, of those mega session, there should be 99% to possibly 100% growth of the transplanted hair. That is very important. You transplant 200 grafts, 200 of them grow, that is good. Okay? Now, if you have any questions, you can just type them. I'll see them here and let you know. Do not be lured by some people who are saying, okay, now I got a question. Can smoking affect hair growth? Should I stop smoking before surgery? As a doctor, what should I tell you? Smoking is bad for health. But of course, if you are a chain smoker, of course, stop smoking forever. But yes, if you are going for surgery, and this is a question which many people ask, not just for smoking, but also for alcohol. How many days before the surgery should I stop taking alcohol or stop smoking? Then I say that you should do that at least a couple of days before the procedure and for at least 7 days after the procedure. Give the body that time of relaxation. Do not take a lot of alcohol in the post-operative 7 days. Right? Just like no heavy exercise for 7 days, similarly. Now another question is, how successful are hair transplant? Then let me tell you, friend, it's not question of how successful are hair transplants. It's question of how successfully does one particular clinic or one particular doctor does his hair transplant. How successfully does he or she deliver in terms of the yield from the number of grafts that were transplanted. I hope that answers your question. Now, going to the next phase. The motto, remember, I tell this even to my patients, that grafts are worth more than diamonds. When a patient comes to me and says that, okay, let me do this, I say, halt, slow down. Why do I say that grafts, the donor hair grafts, are worth more than diamonds? Because you may be rich. You may be able to buy anything. You can buy diamonds. But you cannot buy grafts that will be transplanted on your scalp. So grafts are worth more than diamonds. Do not waste them. I do not say that no one can do a good surgery, but if you are going to a new doctor or where you have not seen a lot of results or reviews, then I tell them, go for a small session. Similarly, when patients, if they are a bit apprehensive, I tell them, go for a small session. If your parents are worried, your family is worried, you are worried that if this is a surgery and this is on top of head and what should I do, then I tell them, this is an art as well as a surgery. Just that it happens to be on top of your head. That does not mean that something is going to go wrong with your brain. Even if I were to want, I cannot push the needle deep into it. This is a surgery which is based only on the scalp skin, right? Now, regarding diamonds. Now, nowhere is this more apparent than in cases of repair surgeries. So, if you are going for a case of hair transplant, if you are planning hair transplant surgery, I suggest go and see our repair section. The patients whose corrective surgeries we performed were also performed by some clinics. Take pause. You do not want to fall for that. Right? Take adequate precautions. Because when you come for a repair later on, after a bad surgery, then the first thing which is gone is the donor reserves. We don't want to end up in that situation. So I'll just say in short, do not fall for marketing gimmicks. Like last time I said, there is no such helpful thing as directly transplanting hair from this place to this place. Similarly, there is no such thing as going for giga sessions or mega sessions. For the patients, it's not going to help you. For the young doctors, do not set such an unrealistic target. Stick to smaller numbers where you know that yes, you have the stamina, you have the capability to be able to take out these many grafts and then to be able to place these many grafts. Correct? And once you have the experience, and once I'm talking to the young doctors now, once you have the experience and then you want to go for more number of grafts, go slow, go for intermittent hair transplant. Give a 1 or 2 day gap at least. Right? Now, let me see, we have more question. How many hairs usually grow out of one hair follicle or graft? Now this question is a bit confused. A follicle is a hair, single hair, but a graft sometimes consists of 2 hair, 3 hair, and in rare cases even 4 hair. So you could possibly take out a lot many more follicles for the same number of grafts. Once we transplant grafts, my aim is 100% growth. I have not seen that if you transplant 100 grafts, 1 graft will not grow or 2 grafts will not grow. That is not something that will happen. If a graft is taken out from here or the chest, and it is taken and transplanted in the correct way and safely, then it will grow. There is no such thumb rule that only 50 or 60% of the grafts will grow. No. Right? Now, let me talk about other things and send me more questions if you have. Someone has asked, how can we choose a best doctor for hair transplant? Well, I will not say just come to me. You can't all come to me. But yes, see the results of that patient. Now, this question also bears important relevance because of something which I see. Doctors claiming that they have performed 4,000, 5,000 hair transplant patient surgeries in just 4 years. How? Or 5 years? How is that possible? In 1 year, let's calculate. 1 year, 300 days, 1 patient per day, 300 patients per year, multiplied by 5. 5 3s are 1,500 patients in 5 years. So, such tall claims, when you come across them, just do your maths and confront the person who is saying this. I have been in this field for more than 22 to 25 years. I don't even remember. I started in 1997. did my first body hair to scalp transplant in 1999, long before internet was something that was too popular in India. It took me a lot of time and experience and effort to reach this place where we can confidently say yes, 2000 to 2500 grafts in a single day. But when I am teaching new doctors, or when someone wants to learn from me, I tell them, go slow, right? Now, let me see if you have more questions. And I see, if you have any more queries regarding this, or if you are a doctor and you have questions, you can ask me. You can email them to me at contact@fusehair.com, or you can send your queries on Facebook and I'll be happy to answer them. Thank you.